So thank you very much for inviting me to speak today. It's a real honour to come here to Toowoomba and join in with so many people of different faiths. First of all, I'd like to acknowledge the traditional owners of the land on which we're meeting today, and obviously leaders past, present and future. So with the sort of introduction that you've just given me, you can get the feeling that I'm going to be more clinical than some other people. And that's okay, it's a different slant on things. So let's start. Yep, I can do this. I want to define very quickly for you what a pandemic is. So endemic means this is a disease that is around in society normally. An outbreak is a small increase in disease, malaria in Papua New Guinea perhaps. An epidemic is something that is much wider spread. You could say, for example, that Ebola in Western Africa in 2013 was an epidemic. And pandemics are worldwide spread of new disease, and that's clearly what we're in the middle of at the moment. Let me just focus you on that picture. That picture, and you've probably seen it before, is a picture of a ward during the 1918 influenza pandemic. So, epidemics have been around for a long time. And if you look very quickly down this list, you'll see that right back to the 500 AD and through the Middle Ages, there were two things that people were seeing in pandemic or epidemic proportions. One was the Black Death, which is from a bug called Yersinia pestis that caused people to die very quickly. And the other is cholera, which is a disease of diarrhea and vomiting. And that was what was common at that time. Then if you look into the 1900s, it's mainly epidemics of influenza. And the 1918 pandemic is a good example of that. And it isn't really until the 2000s that you start to see epidemics of coronavirus. And we've seen three in the last 20 years. First of all, as we've mentioned, SARS in 2002-3, which stands for Severe Adult Respiratory Syndrome, created by coronavirus, and that didn't spread very widely. It was certainly a problem in Southeast Asia, did spread to Canada, but was quite rapidly contained in 6 to 8 months due to some very good public health work. Then in 2015, we saw the advent of something called MERS, Middle Eastern Respiratory Syndrome. That only had a few hundred patients, had a 50% mortality, so if you got it, you did badly. But it wasn't very large. And now we've got COVID-19, or SARS-CoV-2, which is the third of these coronaviruses in 20 years to affect us. I'm going to start with innovation, because I think when we're talking about innovation and resilience, we need to look at what we're trying to do in terms of innovation, and then look at how to make ourselves resilient. So, the most useful definition that I could find, and there are many definitions of innovation, and it separates creativity and innovation. Creativity is the ability to create new and potentially valuable ideas, and then innovation is the process of transforming those ideas into reality by testing and sharing and learning and implementing those sorts of things. And you can see the other sort of definitions up there, including one by Barack Obama, but this I think is probably the most useful. So we're talking about change and development. COVID-19 associated innovations in 2020, and I've just pulled a bunch of them out, particularly around healthcare, and you can see them. So the rapid identification of the genome sequence of SARS-CoV-2. This is the sort of stuff that 10 years ago would have taken us 10 years of supercomputer work to do. It was done in a couple of months by the Chinese, and so by January the 7th, we knew the full genome of SARS-CoV-2. Allowed us to do a lot of research, allowed us to develop vaccines, etc. Obviously, WHO then declared a global pandemic, a little late, but nonetheless did. And then we closed our international borders. Now that I would suggest is something that our government would not have done as a free democratic society. We wouldn't have done it if we didn't see the Chinese do it first. The Chinese did it and were successful in controlling the virus, and so other places in the world did it. We saw, obviously, public health drive for testing, tracing, supported isolation, widespread social distancing and lockdowns with all the problems that we face from that. Economic stimulus measures, hospital reorganization. I have to tell you that in March and April last year, I was involved in the development of what the hospitals thought was going to happen. And we were talking to and watching videos, talking to our colleagues in Italy and Spain and the UK and New York, where they were being completely overrun with sick people from COVID. And they were completely devastated by what they were seeing. We were very scared. We were asked to double and triple the capacity of our emergency departments, our intensive care units, and we were also asked to do something that is really quite frightening from an ethical perspective. We were having to face the possibility that only a few people would get to ICU and the majority would not. Now, if I look at the age range out in this meeting, the majority of you would never have had a chance to go to ICU if this wave of COVID had arrived as we expected it to. Now, fortunately, with all the other things we did, that didn't occur, but it was certainly our concerns in March and April of last year. We saw the development of this widespread morbidity and mortality data. This is the Johns Hopkins data that we've already seen today. We saw changes in clinical management, changes in the way ICU managed things, and suddenly the change in the way we thought about masks. Early on in the pandemic, masks not required. Suddenly we could see the research coming through saying it was making a big difference. We had to change. That upset some people. They said, how can you trust doctors when they can't make up their minds? The problem, of course, is doctors were making up their minds based on the research, and the research was changing. In 2021, we saw a bunch of different things. Electronic tracing and tracking, as we've heard, with the QR app. Second and third and fourth waves in Victoria, New South Wales, and then Victoria again. The developing of more selective and nuanced border and venue closures. We saw the development of virtual healthcare, as we've already heard. I was involved with the development of virtual emergency department. So rather than turning up in the emergency departments, which were all overrun and you were waiting 8, 10, 12 hours to be seen, what we did was take emergency specialists to talk to your GPs, to the ambulance crews, to the nurses out in community, and see if there weren't other ways of providing the care that they would have got in the emergency department if they'd turned up. And that's been very successful and is ongoing. And of course that was being done with outpatients clinics, and general practitioners were practicing largely like that during the lockdowns in 2020. Obviously we then realised that this disease was not only gaining it from large droplets, but it was respiratory as well. It was small droplets that you could walk past me, and if I had COVID, you could get it, particularly with Delta strain. And that caused obviously a lot of changes in public health. Vaccines became available, not very much of it. Then there was issues around safety and efficacy and choice. Can I have the vaccine that I want, or am I going to be given what is available? We've seen issues with vaccine mandates, particularly when it's around your job, age range, boosters, and obviously now this opening up of society, but in a limited way, because what we've got to do is avoid overrunning our health system for the reasons that Shirley-Ann mentioned, which is once your health system is overwhelmed, it doesn't matter what you get, you're going to be in trouble. So you could turn up with a heart attack and not get inside the front door of the emergency department because the emergency department is at 180% capacity. And that's what happens. So we've got to limit the number of people that get COVID because our health system is already working at more than capacity. And of course, living with COVID is going to be the new normal. Over the next 6 months, we're going to see COVID in our society as we open our borders. So, that's if you like, the innovation that's occurred in the health system. What about personally? Well, there's been huge changes, many of them for the good. Working from home has helped many people. Education from home. Greater engagement of parents and children, particularly fathers being more engaged because they're not at work, which is fantastic. More walking and cycling and other exercise. More use of communication apps that, again, Shirley-Ann has highlighted very, very well. More reading, home renovations, the Bunnings outings becoming really, really common. Less focus on commercialism, slowing down, and time for reflection. All positive things in terms of innovation over the last 2 years. Then what about resilience? Resilience is interesting. So again, I've looked for a definition of that. Psychological resilience exists in people who develop psychological and behavioural capabilities that allow them to remain calm during crises and chaos, and to move on from major incidents without long-lasting effects. And in spiritual terms, you could almost call that detachment. And I don't mean by that detached as in not caring. I mean detached as in being able to ride across the difficulties that we face and not let it injure us emotionally and psychologically. Now, there are many ways to strengthen an individual's resilience, and obviously practicing kindness and compassion and gratitude is enormously helpful. Being optimistic and having self-belief helps. Focus on being flexible and adaptable helps. Maintaining emotional awareness and being happy, focusing on being happy helps. Living a healthy lifestyle, clearly, and maintaining all the connections and social connections that, again, previous speakers have spoken about. And engaging in community and neighbourhood preparedness. But we've got to talk about more than the resilience of individuals, because we need resilient societies as well. And this is interesting. Community resilience is a measure of the sustained ability of a community to utilise available resources to respond to, withstand and recover from adverse situations. But more than that, resilient communities promote individual and community physical, behavioural and social health to strengthen their communities daily, as well as in extreme challenges. So this is about what we do every day to strengthen the resilience of both ourselves and our communities, so that when challenges occur, and they no doubt will again, that we're in a much better spot to do that. And again, some of the things that the previous speakers have spoken about the society in Toowoomba makes it very clear to me that this is a resilient community. And there are many building blocks to resilient communities, and you can see them there, promoting access to services, promoting health and well-being of the people, expanding communications and collaboration, building networks, engaging individuals and programs and the vulnerable, which has already been mentioned, and building social connectedness. All of that helps in our community resilience and our individual resilience too. So let me turn now to what it is that has kept us safe, because I think it's really interesting to think a little bit more about public health, because it's also very contentious. So what does public health do? In the broadest sense, it's far more than just infectious diseases, although that is what you see it doing most of the time. It's about health promotion. It's about environmental protection, our food, our water, our sanitation. It's about occupational health and safety, protecting us when we're at work, putting legislation in place so that employers can't expect you to do things that are inherently dangerous. It's about motor vehicle trauma and road traffic management to reduce the impact of road crashes. It's about social health, smoking, drugs, sexual disease, STDs, and infectious disease management. Obviously, if I can prevent tuberculosis from getting into Queensland, you are less likely to get tuberculosis. And so there's all of that ongoing infectious disease management going on. It's about immunisation programs that we're so aware of for our children, cancer screening and emergency preparedness. So all of those things are important. You see, there's a real problem with public health. This is have a look at this picture. This is a picture from a recent protest in the US, and it says, freedom is non-negotiable. The question is personal freedom non-negotiable? Should I be free to inflict risk on others? Or is that not appropriate? And it's interesting because if you look at clinical medicine focuses on the best interest of the individual. You as the individual come and meet with a doctor, you discuss your case, and the best thing is done for you as an individual. Public health is different. It focuses on the best interests of society as a whole and the individual secondarily. And this is where public health conflicts with the modern belief in the supremacy of individual freedoms and rights. And the areas of conflict are easy to think about, aren't they? The mandating of masks and hand washing and QR codes and testing and isolation and quarantine, lockdowns, vaccination, loss of freedoms for the unvaccinated, which is what's going to happen soon as we start to open our borders. So what are our responsibilities to our fellow citizens? There are many protests driven by pandemic disinformation. I just really want to call out the level of disinformation that we're all facing. So, I looked at the WHO website the other day. There are more than 425,000 papers listed on the WHO website since the beginning of 2020, so in the last 2 years. All of them scientific papers. But the social media algorithms that so many of us get caught up in on Facebook and Instagram and things like that continued to promote personal opinion and discredited experts. So when people say to me, "Doctor, don't talk to me about vaccination, I've done my research," I say, where? Where have you done your research? Have you read the papers or have you read the opinion on Facebook? Because it's opinion, it's not fact. And you can see that there's many, many of these ideas that are quite clearly untrue that get repeated over and over. You know, COVID-19 was created as a bioweapon. Outbreaks and the vaccines are related to 5G communication networks. The testing that we do is ineffective. It's not. It's 98% accurate. We've over-reported the mortality and morbidity of COVID-19, and it's actually very safe. It's just the flu. It's just the flu. Face masks are ineffective. Being very firm in my faith will mean that I won't get COVID-19. Being very firm in my belief that if I live healthily and eat the right food, my immune system will stop me from getting COVID-19. Vaccines are ineffective and the side effects are severe. Vaccines cause sterility, and many women in childbearing age and that are pregnant are really worried about that. Wearing a face mask is child abuse. And all these other drugs that people tout as being effective are good, when in actual fact the papers show clearly they're not. None of these assertions are true. So I wanted to turn a little bit now to, is there anything in the writings from the Baha'i faith that I can share with you that would help people in the Baha'i faith at least to guide us through how to behave in this area of pandemics and how to behave around vaccinations. This is one of the writings. Religion and science are intertwined with each other and cannot be separated. These are the two wings with which humanity must fly. One wing is not enough. Every religion which does not concern itself with science is mere tradition. Therefore, science, education, and civilization are most important necessities for the full religious life. There has to be a marrying in our modern society between our belief systems and clearly the things that are proven through science. What about this? Does this help us in terms of our approach to dealing with COVID-19? One of the most famous quotes from the Baha'i faith: "The earth is but one country and mankind its citizens." What that means is we're all equal. We all need to look after each other. Without integrity of character in its citizens and without loyalty to government, a nation will find itself torn asunder and unable to function as an organic society. I think this is really important because I see this happening in the US at the present time. Their polarisation is so great. Their belief structures are so rigidly locked in now, be it on the left or the right, that they can't talk to each other anymore. And if you've got a polarised society, it becomes ungovernable. And that's what I fear for the US. And obviously that could happen in Australia as well. But if we want to function as an organic society, there's got to be agreement and cohesion and cooperation. In relation to the coronavirus pandemic, the Friends should follow the counsel of medical and other scientific experts on the advisability and efficacy of the various vaccination options that are becoming available and the wisdom of particular public health measures. They should not be concerned merely with their own personal choices and well-being, but in reaching their decisions, they should also consider their social responsibilities and the common good. And obviously we've heard that from many of our other speakers today. This is not a personal decision. It is not my right to choose in isolation from the rest of society. And I guess as Jackie Lambie said yesterday, you have a right to choose, but there are consequences of those choices. Nothing has been found in the Baha'i writings on the subject of vaccinations or their prohibition, and it is left to each believer to consult competent physicians in this regard. If one finds that there is differing views within the medical community on the matter, it is suggested that the Friends distinguish between doctors who are well trained in medical sciences and those who are not. Further, since there is no prohibition against immunisation in the teachings, should one decide to forego vaccination, the impression should not be created that the decision is based on religious beliefs. So that's just a little bit of the Baha'i teachings that I would certainly use as a way of working out how I might navigate the complexities of the current pandemic and how we respond to it. So in summary, we've been through very quickly, and it is very quick, I know, what is a pandemic? What about some innovations associated particularly with the health system around COVID-19? What are some personal innovations that we've seen driven by the occurrence of the lockdowns particularly? What do we do in terms of personal resilience, societal resilience, and finally examples of the spiritual response to societal issues in COVID-19? But I want to address the elephant in the room just very quickly. And that is the damage that we can see in society by the huge levels of disagreement that are going on at the present time. And how I would summarise that is a loss of faith in science and the consensus of experts. If we genuinely think that reading some opinions on Facebook is going to compare with the doctor that spent 20 or 30 years studying immunology or something of that, then we've got a problem in our society. That loss of agreement on what is truth means we've got difficulties that we're going to face in terms of how we take our society forward because we can't agree on anything. We've got issues around the systematic misuse of media and communications technologies. We've got issues around the purposeful diminution of truthfulness and sincerity among many of our leaders, and the subsequent polarisation of our population. So, those are the things that as people of faith we have to try and address. Integrity and understanding will allow us to see the reality of our world rather than succumb to the current spin. And as the writing says there, thou shalt see with thine own eyes and not through the eyes of others, and shalt know of thine own knowledge and not through the knowledge of thy neighbours. Thank you very much.